It's one of the most misunderstood and one of the most complex disabilities.
It's complex because there's no scan or blood test that can detect autism. We've got Dr. Dawn Shifrin in studio with us to talk about a little bit about autism awareness. It is Autism Awareness Month, so we're talking about this topic. It's complex because of screening, of detection, of diagnosing. So what should parents look for in terms of signs, and when should they be, their flag raised, something's not right, and go see their pediatrician?
Well, I think that's a great question. I think that the whole point of Autism Awareness Month, and we've had this now for 48 years, it's the fastest growing, most common complex neurodevelopmental, neurocomplex, and neuroatypical disease of children and small youngsters. And the key is awareness, and awareness of what the symptoms are, social symptoms, social interaction, communication and language symptoms. Also in older kids, behavior, shall we say, quirks. These are quirky behaviors, maybe only one toy, very limited interests, and again, difficulty with communication and language, and also difficulty socially interacting with other kids. But there are certain signs that parents can use, and the awareness will lead to concern. Every parent has concerns. Is my youngster developing normally? And there's a great app called Learn the Signs, Act Early that's available at cdc.gov that you can actually put on your phone and track your youngster's development all the way from birth through 5 years. Now, every pediatrician knows that every parent is going to come in and say, is my youngster developing normally? There's a wide range of normal. There's also a wide range of symptoms that can, shall we say, clue you into a possible diagnosis. But again, screening that pediatricians will do, 7 visits in the first year, and definitely a 23-point parent questionnaire that parents answer at age 18 and 24 months is now giving us more awareness and also reassuring parents. But screening is not a diagnosis, and a negative screen does not mean we don't continue surveillance.
Yeah, we've learned a lot about autism, right? So we've taken some very important steps in your view.
Oh yes, absolutely. Again, the statistics are staggering. 1 in 68 youngsters, 1 in 54 boys will have some symptoms that, shall we say, put them on the autism spectrum diagnosis, shall we say, disorder. So again, what we want to do is we want parents to be aware of it, we want concerns to be related to their pediatrician, and we want a frank discussion about, is the screening going to prompt us, parents and pediatricians, to look for, shall we say, a difficult but important evaluation process with a neurodevelopmentalist or perhaps the Kindering Center here in Seattle.
Can you talk about early detection, why it's important for parents to be on the lookout with kids, with babies, and why if you detect it early, they can actually be helped? Well,
again, that's a great question. Early detection, it really is more early screening and early symptoms that we look for. Again, not smiling by 6 months, no language by 12 months, no 2-word sentences by 24 months, difficulty in relating socially to other people, not answering to their names. This will enable us to get help early, therapies early, that can again cause these youngsters to thrive with their interactions with their peers as they get older.
Remember, as opposed to waiting until they're 3 or 4 years old or even older, when this whole time they're having symptoms and parents haven't been doing anything, right? It's going to be harder to give them therapies to help them develop.
That's true, right? And again, it can occur both ways, because in my years in pediatrics, I've said to parents, I am concerned, I think we should get follow-up, and I've had parents say, oh no, it's just a phase. And we've also had parents concerned, and the doctors say it's only a phase and we'll continue to watch. So a lot of these youngsters don't get, shall we say, screened and then evaluated by age 3 or 4, which again is not terrible, but it's a little more difficult to get those therapies to produce a more interactive youngster as they get older.
And we still don't know a cause for autism, right? It's still very much a mystery in a lot of ways.
Well,
right?
that's why the puzzle is out there when we talk about autism, especially the autism ribbon is a puzzle. There's no one cause, there's no one cure, I might add. We're looking at genetic, we're looking at immunologic, we're looking at gut bacteria, we're looking at immune systems. There's a lot of research going on, but again, we haven't found the one cause.
Do you think we will?
I'm hopeful. We always live in hope.
All right, Dr. Don Shifrin, thank you so much. We appreciate your time on this topic that a lot of parents, it's on their minds. I think anybody who becomes a parent, they think about that and want to know how to help their child.
And what's the name of the app again? Give us that one more time.
The app is Learn the Signs, Act Early. It's on the cdc.gov, but it's also can be found both in the Apple and the Google Play places on the web.
Wow, that's great. Thanks, Dr. Don. Glad
Always
you're
a
in.
pleasure.
Always appreciate it. All right.
We'll be right back with a look at weather and traffic in just a moment.